Hello and welcome to Amazing Mind, the HMI Web TV talk show that introduces you to all sorts of interesting people and topics related to subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest who is going to talk to us about emerging adulthood, seeing clients between the ages of 18 and 25. Please help me welcome my amazing guest, Carol Dafesh, who is a marriage and family therapist with a private practice in Manhattan Beach, California. Well, Carol, this is a really interesting topic, and I know it's one that everyone's going to be very interested in. What is the stage of development, 18 to 25?
Well, I like to think of it as basically a rebirth. These kids are coming out of their parents' womb, their comfortable home, their structured life with school, the rules of what they need to do to succeed in life, and now all of a sudden they're on their own. They don't have school telling them when to be in class, what they need to succeed. They have to decide for themselves who they are and what they want to do for the rest of their lives.
Now, I'm not that old, but I remember that when I was 20, 21, I was pretty much paying 100% for my own life and all my own expenses. Many of us at this time are not seeing this with these emerging adults. What are some of the unique issues that are affecting this age group today?
Well, what I think is happening as us baby boomers have decided that we want to take away all the pain from our children and give them everything in life that we didn't get to have.
Yes.
We've bubble wrapped them, so to speak, and really overprotected them. And so now what we have is a generation of 20-year-olds who are sort of going through the terrible twos, experiencing what Margaret Mahler would call rapprochement.
Rapprochement, give it to me again.
Rapprochement.
Rapprochement, if I remember from my early stages of development, I thought that was only for 0 to 3.
That's what it used to be, and what happens in that stage is if you think of the little toddler, 18 months, 2 years old, what they're doing is they're realizing that they are unique from their mother. And so they are supposed to go off and explore the world while mom is keeping her eye on them, watching them, making sure that they're safe. And as they become more and more confident in their ability to go farther and farther, by the time they're 3, they're ready to go off to preschool.
Yes.
But what's happened, I think, as parents have become helicopter moms, like we like to say, the moms who hover over the children, and they make sure that any conflict, mom swoops in and takes care of it, and really doesn't give the children the skills they need to manage life and manage the bumps and grinds of growing up.
So now we're seeing it again at 18, where they go out and
they don't have a lot of confidence in their ability to manage the world. So they are sort of terrified. They have all kinds of choices open to them, choices probably more than we had. Are they going to travel the world? Are they going to get a job? Are they going to go on to grad school? Which state are they going to live in? They have the whole world open to them, and they are overwhelmed by all of their choices.
So describe what kind of issues come into your office as you're specializing in this very important stage.
Unfortunately, most of what I see in my office are kids who are really in a crisis. Severe depression. For whatever reason, all of the delayed gratification or the delaying of the pain is now hitting them all at once. And so we've got a lot of depression, anxiety that might go along with the depression, often using drugs or substances as a way to relieve the pain, just really lost souls.
It's so interesting that among this, do you also see then a sense of needing immediate gratification, almost a sense of entitlement? You ask someone who comes into your office, what do you want to do? They say, I want to be an entrepreneur, and my dad, he's an idiot. he wants me to start in the file room of his company, but I want to be an entrepreneur. Do you see that kind of unrealistic expectation about when one is out of high school or college or has come back from traveling the world?
I'm not seeing so much of that in my office, but I sure know that it's out there. These kids really, because their parents have given everything to them on a silver platter, they just expect that they're entitled and they're going to keep getting things that they haven't really gone out and earned.
So what is causing this crisis that comes into your office with the depression? And is the substance abuse because they are self-medicating?
Yes, they absolutely are self-medicating. I think what's happened is they just do not have a sense of who they are. And I like to go back to James Hillman, and he has an acorn theory.
An acorn theory, I love the metaphor as being a hypnotherapist.
His theory is that each of us come into this life as an acorn, the little seed that's destined to become a grand oak tree. And in that acorn, we go through our life experiences. But also a part of that acorn is that unique soul, that unique person who we are. And through childhood, we lose that acorn. We lose we forget who we are. Our parents have expectations about, no, you should be doing this, you're going to be a doctor, you're going to be a lawyer. Our teachers tell us that we have to be this way, you have to get into such and such a college. And then our peer groups tell us who we are and who we have to be. And of course, not to mention all the labels that we get growing up. And at this age is the perfect stage to say, wait a minute, am I all of these things? Am I going to be the doctor? Am I going to be the class clown for the rest of my life? And so these kids really need to figure out who is the essence of their soul. What is the essence of their soul? Who do they want to be when they grow up?
Oh, sure. And, you know, you talked about the helicopter mom, and guilty. But if we have a 20-year-old whose parents are paying for therapy, what is your involvement with the parents? You know, you're a marriage and family counselor, but when you're seeing an adult, what is your involvement with the parents who are paying for the therapy?
Well, that is actually the beauty of them being older than 18. The parents don't get to know anything. These kids get complete confidentiality. And I like to manage it that way because now I'm setting them up to say, you're the adult, you decide whether you're coming in or not, and you decide how much you want to work in therapy or not. And so I set the expectation that this is your life and you're going to work as much as you choose to work. And the parents don't get to know.
With that, it's a very, very safe place. Are young adults candid with you?
If I set up that very first meeting with them in the way that I like to, yes, they will tell me everything. For example, I had a young man who came in, used all kinds of drugs, was in a very serious depression. He was there because mom told him he needed to go.
Sure.
And I listened to him. I listened to him about all the drugs that he used, and I asked him all kinds of questions. Now, I'm not condoning the drug use, but I'm really curious about his drug use. What sensations does he experience in his body when he uses them? When are the times that he's using the drugs? I may find out that if he's particularly attracted to cocaine, maybe he has undiagnosed ADHD.
Sure.
And so I listen and I ask all kinds of questions, and I tell him, I'm not going to tell you to stop using drugs. And I say, but I really want to understand why you're using drugs, and more importantly, I want you to understand why you're using drugs.
Have you found that that helps to diminish the self-medicating?
What happens is that kid left the office, and he said, I'm coming back. He had later said, had I told him stop using drugs, I would have never seen him again. And sure enough, over the year of treating him, his use was less and less. He was using less dangerous drugs, and is really now at a point where can just use recreationally and not for needs of self-medication.
Really interesting that the listening and the really coming alongside instead of coming at seems to be the secret of treating young adults and making that safe place in your office where they can be safe here, go out, and come back. Well, I'll tell you, Carol, you've really elucidated what the issues are with young adults. But when we come back for our second segment today, I want to talk about how we can help this particular clientele, what kind of methods, what kind of language, and maybe you can even teach us some techniques so we can help the young adults in our office.
Absolutely.
But right now, we have to take a short break. But please stay tuned, because when we come back, we're going to talk more with marriage and family therapist Carol Dafesh about treating the emerging adult in our private practice. Stay tuned. Therapist with a private practice in Manhattan Beach, California. Well, Carol, this is a really interesting topic, and I know it's one that everyone's going to be very interested in. What is the stage of development, 18 to 25?
Well, I like to think of it as basically a rebirth. These kids are coming out of their...
Now, I'm not that old, but I remember that when I was 20, 21, I was pretty much paying 100% for my own life and all my own expenses. Many of us at this time are not seeing this with these emerging adults. What are some of the unique issues that are affecting this age group today?
Their parents' womb, their comfortable home, their structured life with school, the rules of what they need to do to succeed in life, and now all of a sudden they're on their own. They don't have school telling them when to be in class, what they need to succeed. They have to decide for themselves who they are and what they want to do for the rest of their lives.
To subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest who is going to talk to us about emerging adulthood, seeing clients between the ages of 18 and 25. Please help me welcome my amazing guest, Carol Dafesh, who is a marriage and family therapist. Hello and welcome to Amazing Mind, the HMI web TV talk show that introduces you to all sorts of interesting people and topics related.